my ministry officials and I, we did identify 4 main pillars that we are going to use to deliver universal health coverage. Your Excellency, we have the pillar on commodity security, which the President launched on Friday. We want to ensure that if a Kenyan walks into a facility, hataambiwa nunua panado pale nje, atapewa kwa sababu iko kwa facility. So we have capacity build our institution, KEMSA, to ensure that we increase the fill rate. Governor here will tell you, when we came into office, the fill rate was 50% if they did so well. But at the moment, we are headed towards 70%. And our plan, Your Excellency, is that in the next 3 months, we should be at 80%, headed to 100% in the next 6 months. And Your Excellency, we are supporting local manufacturing. Many people think that it's a joke, but they were able to showcase. And we have many, many manufacturers who have products here. And since we are deliberate, Your Excellency, the last tender that was put out by KEMSA, worth 5 billion, 2.5 billion, was ring-fenced for local manufacturers. That is how intentional we are. So we are moving very well on that pillar. Your Excellency, our second pillar, which we started discussion last week and shall be progressing through this week, is on our human resource for health. You know, you can have all the equipment, you can have a perfect building, but if you don't have a health worker, it doesn't work. So we shall also be discussing how best do we have a motivated health workers and how do we manage them. We shall also be discussing the whole life cycle of a health worker, starting from production. And that corner there, Your Excellency, is one of our production units for health workers, Kenya Medical Training College. We are discussing how they move from there up to the time they work and up to the time they exist. Since we have been in office, Your Excellency, we have been able to inaugurate the Kenya Health Human Resource Advisory Council that was non-existent despite being in the Health Act of 2017. It is only until 2022-2023 that we inaugurated it, and we believe that it's going to be a game changer. Your Excellency, our third pillar is on digitization. You have been able to witness for yourself that we have begun at the bottom, which is the essence of this government, bottom up. The community health promoter has a gadget, and I want to thank our partners, Safaricom. They have been able to support us on that. And Your Excellency, the best thing about those gadgets is that they're locally assembled. Hatujaleta kutoka mahali pengine, ni za hapa Kenya. So it's a demonstration that we are also supporting local manufacturing for digitization. Your Excellency, we are working together with our other partners that have supported us, WHO, USA, to ensure that we put people into a primary care network. And that is how you saw Mr. Emmanuel CNA's name from his village to the health facility to Kapkatet sub-county. His name was there because we are able to leverage on digitization. Your Excellency, this digitization will create visibility for us. You know, kumekuwa na wakora wengi, wale wanafanya health inakuwa very expensive. But this digitization is helping us on health commodity management. You are able to see the items at the level 3 facility. We saw the items at the sub-county, and I'm sure even at the county hospital, we are going to be able to see movement of products. Your Excellency, the last pillar, which I think is the most important, is the social health insurance. What we are going to do for Kenyans to ensure that each Kenyan can access health services without suffering financial loss. And I really want to thank the members of parliament, led with my chair of the health committee who is here, Honorable Bukese. I see my vice chair, Honorable Monene, and one of my committee members, and also the members in the Senate, Your Excellency. They did a tremendous job in working on the bills. So we are just waiting for the final whistle to be blown, and we say hallelujah. Now the healthcare of this country has changed. Your Excellency, I want to thank you for the support, that you have been a champion of this universal health coverage. And I'm going to do my best. If there's any time I have loved my job, it is this time. Because I can see the impact on the faces of Kenyans. I saw the impact on Emmanuel's face when we were in his household this morning. I saw the impact on the 100,000 community health promoters that we have given kits. Your Excellency, and the community health promoters are very happy because starting this October, they are going to get a stipend. And as a national government, we have put in 3 billion shillings per year. That is not a mean achievement. So I want to thank you. But I want to ask Governor, please, we are in this together. Primary health services is your responsibility. But if we work together for the people of this country, we are going to change the landscape. I know in Kericho you have over 1,600 community health promoters. We are going to work with you. Equally in Bomet, I know you have about 1,900. We are going to work with you to ensure that we change the health landscape of this country. Your Excellency, I have not been working alone. My team at the ministry is an A1 team. We have been playing together very well. My PSS, Modoni, Kimtai, the directors, the Director General, we have been working together as a team. And I want to promise you, this team is going to deliver on all the promises of Kenya Kwanza. With those many remarks, I would like to take this opportunity to ask us all to be upstanding so that we invite His Excellency, the Deputy President of the Republic of Kenya.